My name is Megan Ingram and I'm a fourth semester student at MCC. Today I will be teaching on common errors in insulin administration and what you can do to prevent them. I have my audience here with me today. And I'm my lovely camera lady.
Hi.
Alright, so what do we think some common insulin errors could be? Well, sometimes we don't store our insulin properly. Sometimes we don't draw up the correct amounts of insulin before we inject. Sometimes we don't clean our sites on our bodies or our insulin vials correctly, which can lead to infections. And then sometimes we don't inject appropriately. We use wrong techniques, we use wrong injection sites. So today I'm going to begin by going over some of these things and what you can do to prevent them. But first of all, why is this important? Well, sometimes, according to the article, Errors of Insulin Therapy, a majority of the population with diabetes who are insulin treated fail to achieve appropriate levels of their hemoglobin A1C. So with the dominance of this diabetes expanding, it's important that we teach our patients how to self-administer insulin correctly and that we teach our healthcare professionals how to administer insulin correctly. Otherwise, with a hemoglobin A1C level that is not good or appropriate, this disease can progress further and become worse. So the first thing that we run into is improper storage. Most people don't know that insulin should be kept between a certain degrees. This degrees would be 35.6 to 46.4 degrees Fahrenheit. So typically people will keep their insulin in the refrigerator, and that is appropriate. But sometimes they'll keep their insulin in the refrigerator that's closest to the freezer, in a place that's closest to the freezer, and that can be a problem because if your insulin becomes frozen, it basically becomes bad and it won't work like it should. So it is best kept in the refrigerator, either in the patient's home or in the hospital. We have refrigerators that we keep all of our insulins in. And then if you're traveling, it's most important to keep your insulin in an insulated bag or a thermoflask that's cooled. And it should never ever be kept in your car in the glove box or in your car with the windows rolled up, because then it has the chance of becoming too hot. And the same thing happens. The insulin is ruined and it doesn't work properly. And therefore, the patients who use the insulin don't have the desired results. So insulin should never be kept, like I said, in the glove compartment or in a vehicle with the windows rolled up for an extended amount of time, or it should never be placed in your check-in bag when you're flying. So, and that's one thing that many people don't realize, but if you think about it, when you get to the airport and you give them your luggage, what's the first thing they do? They throw it. They throw it on the ramp, and that, is a source for broken insulin vials and, wasted medication. So that's very important that a lot of people don't realize. It's best kept in a cooled bag or a thermoflask in your carry-on if you're going to be flying. That's, close to you in your possession so that you can properly handle it and make sure that your vials don't get broken, as well as your needles and your other supplies that you need too. You don't want those to become damaged in any way. So what do you do if it's been stored improperly? Well, basically, if it's been stored improperly, it's no good. It has a high risk for the loss of bioavailability, and it loses its efficacy. So simply put, when this medication is stored improperly, it won't work, and you have to waste this medication. You cannot use it, and you cannot keep it, because then that would probably lead to forgetting that it's no good, and you would end up using it. So you must get rid of it. And why does that matter? Well, people who have stored their insulin improperly have failed to meet those appropriate hemoglobin A1C levels. And as I said before, the prognosis gets worse, and your body is less able to fight off infections, and you're just not as healthy as you would be if your hemoglobin A1C was controlled. So that brings us to the next slide. Dosage errors are another problem with ineffective insulin administration. Sometimes the doctors will write prescriptions, and we all know that doctors' handwritings may not always be the most legible. And so we also need to pay careful attention to abbreviations, and sometimes, as I have on there, sometimes we will mismatch our syringe to our vial, and it's important because each syringe has on there what kind of syringe it is, whether it's a 100 unit or whether it's a 40 unit. And it's very important because a 100 unit syringe denotes 2 units per line on the syringe. And then a 40 unit syringe denotes 1 unit per line. So this could be a problem if you are drawing up 40 units with the 100 unit syringe and you didn't calculate your dosage properly, or you couldn't read the doctor's orders properly. So it's always important to know how much you're drawing up with what kind of syringe you're using. And it's stated that grossly elevated blood sugar levels have resulted from using a 100 unit syringe to administer insulin from a 40 unit vial. And the outcomes of that show that 2.5 times less insulin was administered, but that being said, your patient is not getting enough insulin that they need, so they have more risk of becoming hypoglycemic and further problems. Our next problem is improper cleansing techniques. So injection site infections can occur if the skin and vial are not cleaned properly. Your skin should always be cleaned with an alcohol prep pad, and you should always do it in a circular motion, starting from the inside and moving out, because you want to go from the cleanest to the dirtiest, and you don't ever want to go back in. You want to make sure you go from the inside all the way out to ensure that this point where you're going to be injecting is the cleanest. And you also want to allow the skin to dry completely, so that it doesn't sting as bad wherever you inject, and that it'll be clean, but it won't sting, because that's not pleasant. And you also want to make sure that you clean the top of the insulin vial, because especially if it's not a new insulin vial and you're reusing it, contamination can occur. And here are some infections that have that can occur because of improper cleansing techniques. And of course, with diabetics, their immune system is not as strong, and so they are not able to heal as well. And so this can occur from improper injection technique and not cleansing the site properly. So some acceptable sites for insulin injection include the upper outer arms, not the upper inner arms, the abdomen in your belly area, and then the upper outer thighs, not the inner thighs. And this does not mean the tops or the insides of the thighs, the outers. So I've given you a handout that has the injection technique. And so if you'll read with me, injecting correctly, the insulin needs to be absorbed steadily to work properly. And so to put it in there properly, you do want to pinch the skin gently and inject the insulin at a 90-degree angle into your subcutaneous tissue. Okay. So in conclusion, insulin administration, whether it is administering insulin to yourself if you're a diabetic or to others if you're a healthcare professional, is very crucial, and many people are dependent on accurate insulin administration so that they can be healthy and avoid further problems with hypo and hyperglycemia. Insulin should be stored properly to ensure the efficacy and to make sure that we achieve those desired hemoglobin A1C levels. It should be drawn out of the appropriate vial with the coordinated syringe, and the injection site should be chosen properly and cleansed with an alcohol swab before injection to avoid infections. Do I have any questions? All right, that is my teaching project on common errors in insulin administration and what we can do to prevent them. Thank you.